Good morning. We are talking about sciatica. So, just for a visual of like an actual bony structure. So our nerve runs down our glute into this area here. That's why it runs across this way and it kind of go down this way. And it's like a thick tube that goes underneath a muscle called your piriformis. Sometimes, not all the time, that piriformis gets super, super tight and it can constrict that tube-like structure, causing the zingers going down the back of the leg, can go into the back of the knee, can go all the way back into the back of the heel, everything like that too. So this is the area where we're kind of focusing on. And we're also focusing on the lumbar spine too, because all of these nerves go towards that sciatica nerve.
So again, your sciatic nerve is the biggest nerve in your body. Yeah. And I just wanted to, thank you. We'll be passing this back and forth. Microphone is important. Dr. Jess talked about that piriformis muscle, and there is such thing as piriformis syndrome as well, which can replicate those sciatic-like symptoms, the shooting down your leg, numbness, tingling, etc. Maybe it goes all the way to your foot. Maybe it's just through your glute or through your thigh, to the top of your knee. Symptoms really look different here. And I believe we were going to start off with what we do in clinic here, so you can see how we can help you, how a chiropractor can help you if you're not local to us. And then, of course, we'll tackle some different at-home things that could help, keeping in mind everybody's tolerance of these things will be different, especially when it comes to that low back, that lumbar spine. If there is a true bulging disc in your low back, some of these things could possibly be very, very uncomfortable for you while you're super flared up. But again, the idea is that we help decompress and create space.
Yeah, create movement.
Yes.
And then help you feel better. And especially during pregnancy too. This is one of the symptoms that we see very frequently.
Very.
Because everything is shifting down here.
Yeah. Forward.
Coming. Yeah, exactly. And so just keep in mind throughout pregnancy that this can be troublesome.
Very troublesome.
Yeah.
So, flexion.
Yeah, Mariah's going to lay down in the table here. We are going to start off with some flexion distraction. And so what we do with this is it creates a really great space in the lumbar spine to decrease any pressure that's going on in the nerves. I'm just going to focus on this one side here so you can visually see. And I'm not standing in front of the camera here. So I'm just going to gently put up pressure and then stretch her low back. So this fluid motion provides that great opening with the space, and it gives those nerves a little bit of break and everything like that. So, and especially throughout pregnancy, it's really difficult to stretch your low back. And so this can provide that really great decompression and that pull that you're looking for throughout pregnancy. So when we are doing this, we do it a couple of times, up and down. We focus on both sides, and then we get into our adjusting piece. I will say, whenever you come into the office, we always use hot stones on your piriformis muscle as well. So we take your hot stone, we're gonna go down the spine and then dive into the glute. So I'm gonna show you what we're do with my thumb, just because to be a little bit more specific. So I'm going to show on this side, but the muscle goes from tailbone to sit bone. So it crosses the glute right here, and that nerve runs right directly down it that way. So when I am here, I'm just going to take that sit bone and then drive my thumb into it, that piriformis muscle, and then stretch it off to the side.
And let me just say, that is surprisingly, unbelievably tender. So,
yeah,
we'll show you at-home stretches for this as well, but, and it's one of those hurt so good, right? Like, you need it done. Thank you, Dr. Jess.
Oh, you're so welcome.
Because, again, as she mentioned, so much is shifting in our pelvis and whatnot. So, I know we kind of did some adjusting this morning, but should we just show them what drop piece looks like?
Absolutely.
And whatnot? Yeah. Whatever you feel or need.
Yeah.
I can also set up on you for side posture.
Oh, yeah, absolutely. So a couple different ways here. Whenever we're checking leg length, we always love to double check with the tension piece that comes with it. And so the tension piece is that flexion with the knees and leg length, just to kind of see what the pelvis is doing, because if one leg is offset, it can kind of shift the pelvis, so we kind of know where to go. And Dr. Mariah's sticky side is her left side today. Yes, I did adjust her this morning, but she was also treating all morning too, and so it is just a teeny bit off again. So I'm gonna go ahead and adjust this side one more time today, just gently, just to get that movement in there. And so I'm actually gonna do a double contact with this side here and the other side, just to kind of shift it back. There's many different ways to adjust the pelvis when throughout pregnancy, as well as if you're dealing with the sciatica, and then just double checking leg length and then that tension piece again, and she is beautiful. And so with the pelvis shifting throughout pregnancy, that sacrum piece can definitely shift slightly. This big tailbone here, it can shift up or down, it can shift side to side, causing a little bit more discomfort on that lumbar spine to where those nerves exit. So,
or you could also think your sacrum, your tailbone could need the adjusting, and you could be thinking that it's your SI joint, your pelvis, because I mean they connect. That's where you get the joint, because that hip bone comes back to meet the tailbone.
Right.
And you have to work together.
Yeah. And then I'm gonna get Dr. Mariah to set up in side posture so that you guys can see. So we did my left side this morning, so we can do my right side
Right, little back.
for this video.
Do you want more head
I
support?
think it's honestly okay.
Okay,
I'm
you
comfy.
got it.
Yeah.
I love it. So of course in the office we're always focused on what feels good for our patients, etc. We're not going to put you in a position. If Dr. Jess had, real sciatic symptoms and couldn't tolerate this, we may not do that. But
Always patient specific for sure.
absolutely. So, little side posture, right? We can work if we're, oh, it was beautiful, low back, her lumbar spine, that's right above her pelvis. She moved before I got there. Let's also just have her take a deep breath in case. And yeah,
Beauty.
okay, she moved.
Yeah.
While you're here, will you stay face up?
Yeah.
Let's talk hip flexors.
Okay.
So hip flexor. Thank you. Your hip flexor is a muscle that attaches on all of your lumbar vertebra in your low back, so the bony aspect. And then it is a two-part muscle. So part of it attaches in the pelvis, but we're usually focused on this long piece that people think about and kind of feel in your hip crease in your groin area. That muscle attaches to actually your femur bone and helps you flex your hip or bring your knee towards your chest, right? So as you're biking, you're running, you're walking, going up and down stairs, etc. We need this muscle, but it also can get shortened if we have a anterior pelvic tilt, which happens often during pregnancy, yes, but even without that, then those muscles in the back get stretched, overcompensated, and we're short and tight feeling possibly in the front. We always work on hip flexors in this office because it is so important to our structure and function. So I'm going to start with her leg bent. That relaxes the muscle. I'm going to find Dr. Jess's hip bone in the front of her pelvis, as so. And then I dip just inward and down, applying some pressure. Is this tolerable? And when she's ready, she's going to straighten this left leg for me, all the way down to the table, and let it go, really relax. Then I will relax my pressure, she'll come back up. We're always doing at least 3 each side, right? This will be patient dependent, of course, as well. Let's do one more and go right ahead. So this is certainly like a partner stretch, right? You kind of need 2 people here. You will not get the same effect if she tries to hold her own muscle. It just doesn't work. No. What else in office? Should we dive into some at home? Yeah, okay. One being, well, Dr. just showed you the Piriformis stretch. I am going to walk around and take a seat here. You can do a seated piriformis. So your ankle over your knee. No longer are we crossing our legs. That offsets the pelvis. And then that translates all the way up the spine. So ankle over knee. And personally, I see a lot of pushing down, and I feel that right in the hip joint. To me, that doesn't stretch much. So I like to remind my women in here to be seated nice and tall and hinge forward at the hips, hinge or lean forward while still staying tall, and then I get that stretch in my glute. An alternative is to interlace your fingers, pull that knee up towards your body, and I feel that already, again, in my glute through that piriformis. You can also look up and away from that hip, that glute that you're stretching.
Yeah.
Any pointers, any tips here, Dr. Jess?
Well, just keep in mind when you guys are stretching, wherever your eyes go, it'll intensify that stretch just a teeny bit more. We have a direct fascial connection throughout our entire body. It's like saran wrap surrounding our entire body. So if you wanted to intensify your stretch just a teeny bit, try looking where you want to go, because truly, try it. It intensifies it just that much more that you need. So
thank you, that was wonderful. Now, of course, you can also stretch your hip flexors at home. So if I am in this kneeling position, mind you, we have a ton of varieties of how to stretch your hip flexors, so we'll link that below. But whatever leg is forward, I want your coffee table on that side so you have some stability. Maybe the wall is on that side. We just want you to be mindful of balance. I'm going to keep my torso up nice and tall, but tuck that pelvis, so no anterior pelvic tilt. I'm almost working as I'm tucking my tailbone, so almost a posterior pelvic tilt. And then I am just leaning forward a bit here. I notice right away I can bring my leg forward more. Now, a couple things here. This hand can come to my leg, and I can push myself up and back.
A little bit more
of that stretch, yep. Looking up and over.
Yeah, she gets a little bit of that round ligament as well. So if you notice that zinger that's kind of going on around ligament, you can for sure stretch hip flexor and round ligament. It's like a double whammy, and it'll make you feel amazing.
Yes, it will. Always do both sides. So if I was going to switch sides, I would completely turn around and switching legs. How hilarious, because now it's the right hip. So same thing, leg, coffee table support, tucking the pelvis. And I find when I bring my hand up and over that I may get more of that side body round ligament as well. The other beautiful piece that I did not mention while being seated is we can talk about nerve flossing for days. Your sciatic nerve doesn't actually stretch, but you can floss it through those tight tissues. Yeah. So be mindful and gentle and work with me here. But what I'm thinking is we're having that leg come up, and then I can flex my ankle, toes to the ceiling, and then I could tuck my chin. And or sometimes just flexing and extending that ankle is going to be enough. And when I pull my toes towards me, I did get just a little zing. Like, not that I am experiencing sciatica, but there was a little numbness there.
And try this if you have that restless leg syndrome as well, because this nerve is usually the contributor. So nerve flossing is going to be key for that. So.
All right, you guys, comment below, subscribe, let us know what you need. But thanks for hanging out.